Hello and welcome to a new episode of Majlis podcast by Emirates Hospital Group. I'm 𝗠𝗷𝗶𝘀, your host for today, and I'm a family medicine consultant. Today is a great pleasure to talk with Dr. Zofia, who is going to talk to us about HPV vaccine. Dr. Zofia.
Hello, thank you for hosting me today. My name is Zofia Gordon Sönmez. I'm consultant, obstetrician gynecologist. I work in Emirates Hospital, 𝗠𝗷𝗶𝘀.
Very nice to have you here. And as long as you don't ask me to spell your last name, then I'm very happy to proceed today. Is that okay?
Yes.
Good. So today we're going to talk about HPV. We hear a lot of people worried about it. Some people actually the opposite, not even worried and not having ever heard about HPV vaccine. So please, what is HPV and why is it important to my health as a man or my wife's health?
Yes. So let's start from the very beginning. So HPV stands for human papillomavirus. Actually, it is not just one virus. It is a group of viruses. So far, we know more than 200 types of HPV. They are very common, and in most cases, they don't cause problem in people. Approximately 90% of infections self-resolve within 2 years, but there are some of them that can cause problems, like genital warts and certain types of cancer. Because we should also remember that this is not only cervical cancer, it's not only one type of HPV cancer. Now we can list also anal cancer, head and neck cancers. This is the group of the cancer that increases. And then also HPV is related to several types of cancer. We can list vulvar, vaginal, cervical cancer, which is the most numerous, anal cancer, and head and neck cancer.
Okay. And that's very important because a lot of us would assume it's only related to cervical cancer, and that's because a lot of the media initially was focused on that topic, and that's very important. Thank you for highlighting that. It's not, it's way beyond that.
Yes, and it affects both genders, because like anal cancer, throat cancer can affect both males and females. Also, HPV is noted in some cases of penile cancer in males.
Okay. So, and I know you mentioned the 200 types, and you said that some types are the more important ones. So it's not all bad news if I have HPV. Which ones are the ones that we should worry about as a patient, irrespective of the gender?
So there is a group of viruses that are clinically significant, and they are related to HPV-caused disease. We can divide them in two groups. They are high risk and low risk. So starting with the low risk, we can list here two types, which are 6 and 11. They are low risk in terms of causing disease, cancer, oncological disease, right? But they are responsible for development of genital warts. These are like a small skin tags which can appear in the genital area, in anal area. On some occasions, also they can affect throat. And the other group are high-risk genotypes, and here the list is a bit longer. And high risk means that they have high potential to induce the cancer development. Among them, the most dangerous one are type 16 and 18, and they account for 70% of cervical cancers.
Okay. Fair enough. Now, because there are 200 types, now as a person listening, it's like, okay, so are you going to test me for all of them? What symptoms will I know? I mean, maybe let me ask the question differently. How do I get tested? How do I get it? So how is this HPV transmitted? And who's at risk? Am I at risk now? How do I get it?
Yes. So anyone can get it, actually. So HPV is transmitted by skin-to-skin contact of the infected area. So as we know, the virus infects anogenital area, but also mouth and throat. So any direct contact can be source of infection. So not only full sexual intercourse, but any type of direct contact. And what is also very important to remember is that you can get infected from the person that has zero symptoms.
Okay. it is kind of could be depressing news, but at the same time it's not, I'm sure. But so when do I should get tested, or who should get tested? When should they get tested? Because it's not anymore just the cervical area. So what are the symptoms as a person today, myself or my wife or any friend who's there? What are the symptoms? What is the advice I need to tell them? Like, have you done your HPV testing?
So let me start from the very beginning. You asked me about the symptoms. So the infection is mostly asymptomatic. In terms of the low-risk types that are responsible for genital warts, of course the warts can be noticed. They can develop weeks to months after the infection. But the high-risk strains are mostly asymptomatic. The infection remains latent for many, many years before the disease develops. So later on, the symptoms that are noted by the patient are rather related to cancer, not to the infection per se. So that is why it's important to prevent it and to test patients that we see in our clinics and to advise them to be tested. Of course, the screening program is only implemented for women, and we screen for cervical cancer. There are no screening programs for males yet. We'll see what future brings, but as you probably know, to become a screening, several conditions must be fulfilled. So as for now, we have screening for cervical cancer, and the HPV tested is implemented in that screening. So I think this is what we should keep in our mind.
Fair enough. You mentioned prevention as in kind of a big part of it, and I want to come back to that in a minute, but I'm going to challenge a bit there and maybe kind of going a bit tangential. I see it a lot with patients that because the HPV, the virus, is transmitted through sexual contact, sometimes there's a confusion with the category of sexually transmitted disease and could cause a strain on relationships. And I'm sorry if I'm putting on the spot here, but...
True. Yeah, you are right. It's very important to deliver the message and to educate the patient in a right way so it's understandable. Like, as I mentioned at the very beginning, most of the infections, they self-resolve. What is even more important, the people, the bit younger group, let's say 20 plus, the occurrence of the infection is very frequent, but as I mentioned also before, like more than 90% of infections self-resolve. But still, our focus is on persistent infection, because this is the one that stays longer than 2 years, and this is the one that is really dangerous. So, of course, there are different screening protocols in different countries, but as for now, we advise our patients to undergo co-testing. So not only pap smear, but also HPV testing, because this gives the information, what is the prognosis for future. Are you safe? Because if you are not infected now, then it's very unlikely that within a year or two you would develop HPV-related disease. It takes time.
And I guess that's what also brings back to the issue of the genotype. So then you know which type we have if you do the test. Okay.
The tests are very specific. The test, it's type of PCR test. So we have the list of the types that are identified, like we have it divided in the low risk, high risk, and there are like more than dozen of different types that we test, because these are the ones that are clinically the most important.
And maybe just to lighten the topic of that, I think whenever people hear the word PCR, I think there's a lot of this pandemic time of stress. But I remind people that PCR, exactly, it's the technique we use to test for this.
Exactly.
So you mentioned prevention, and you mentioned mostly asymptomatic. If I end up having an HPV that's a bit risky, or one of the genotypes that are flagged, what treatment will I get, let's put it this way, and what should I do to prevent this? Not for me if I end up having the diagnosis, but someone else who doesn't and wants to prevent this. So basically my question is that what are the treatment, if any, and what is more importantly, how do we prevent these conditions?
This is a very good question. And the answer is there is no treatment. So that's bad news, but there are also good news. Yeah. So there is no treatment for the viral infection. Our immune system might be able to eliminate the virus, but as for now, we don't have the medicine that would magically make the virus disappear. So we need to prevent persistent infection. So first of all is to vaccinate. And this is the beauty of that vaccination, that it actually prevents the HPV-related disease and cancer, because it includes the types that cause genital warts and also the high-risk types. So, for instance, the vaccination that is available here in the UAE, of course, I won't be mentioning the name, but it's nanovalent. It means that it covers 9 types of HPV. 2 types are low risk, and the remaining 7 types, they are responsible for more than 90% of cervical cancer. So by receiving that vaccination, the woman has like more than 90% of chance to not get the disease. Of course, there are several other factors which can affect the response of the body, and first thing is the age of vaccination. So if it's given in the right time, then the person would benefit the most. Later on, when we already have a risk that we might have had contact with the virus, of course, the efficacy might not be that good, but if it's given in individuals, and what's also very important, it should be given to both genders, boys and girls, between the age of 9 and 14. So this is the time when it's most beneficial. So this would be the primary prophylaxis. So we prevent persistent infection to occur. And then there are other steps of prophylaxis. There is a secondary prophylaxis, which is detecting the individuals that are affected with high-risk strains, so that we can cover them with proper follow-up, and we are sure that they won't develop the cancer, and we can identify pre-cancer lesions, for instance, and treat them before they turn into cancer. But again, this is not treatment against the virus. It is the treatment against HPV-related disease.
Fair enough. Thank you. Now, I'll go back to the vaccine, because you mentioned the age. And I know initially when the vaccine came into place, there was this kind of idea, first girls, 9 to 12 plus or minus, let's put it. Now you clearly emphasize that no, it's actually for both gender. But 9 to 14, though, because I think I still find it in some adults who are saying, no, I'm too old for the vaccine. Am I too old for the vaccine? I'm almost 48. Let's say for some reason, I got diagnosed with HPV. Can I still get the vaccine, or what do you recommend for people who are older, who are still not sure, irrespective of whether their sexual activity, whether they've been detected with HPV or not? Is the vaccine still an option, or it's just that I missed the boat in a way?
Yes. So to summarize, the vaccination for the youngsters, it should be given, it is registered to be given from the age of 9 for both genders. So the best is to have it administered between 9 and 14, and this comes from 2 facts. First is that it's very unlikely that these kids, they had contact with HPV. So their immune system, we say it's naive. So the response, seroconversion, the titer of the antibodies is the highest. So the vaccine is the most efficient at that point. And the second thing, like the response of immune system biologically in that age is the best. But the vaccination is not limited only to that age group, of course. The studies and the registration is for the individuals until 45 years of age, because later on, honestly, it won't be that much beneficial in terms of the seroconversion. Plus, during the lifetime, there is a higher risk that someone had contact with the virus at all. So we can offer it to our patients, again, both genders, even when they were infected with HPV before. Now, there are reports and there are studies that it can be even beneficial after the surgical treatment of HPV-related disease. And we know that it is very unlikely, I won't say impossible, because as you know, in medicine, nothing is impossible. But it is very unlikely to be infected with all types at the same time that are included in the vaccine. So still, even if someone has one of the types, that person can be protected against infection with the other high-risk strains. And co-infection with more than one type is more risky. So it's still advisable to offer and to educate our patients for HPV vaccination.
Perfect. Except if I'm as old as myself, because now apparently after 45...
Really?
Not. Fair enough. So you're talking about the HPV and the prevalence in the population, but who is at risk? And more importantly, what are the risk factors when it comes to the things that patients and people should be aware of?
Well, the shortest answer is that everyone is at risk, but there are several risk factors that are related to HPV infection that contribute in promotion of prevalent infection. And this is the one that is clinically significant. Persistent infection, and sometimes our body eliminates the virus itself, like sometimes in most cases. But for the cases that turn into persistent disease, there are known few contributing factors. So we can list in here early onset of sexual activity, of course, number of sexual partners, but also smoking, also untreated vaginal infections. If we're talking about cervical cancer, because like this is the most significant problem in numbers, right? So also any infections in vagina, abnormalities in vaginal flora, high number of vaginal deliveries as well, and also immunocompromised people that are under oncological treatment sometimes or with immune deficiency syndrome. So these are the situations when there is higher risk to develop persistent infection that later on turns into cancer.
Listen, Dr. Zofia, it was really a pleasure. That was an enlightening topic and very important. And I think really the key thing is really prevention. So get tested, screen, and then take the vaccine if you can.
Sure.
Any last minute message you want to pass to our audience today?
Yes, I would like to encourage everyone to ask their doctors on their next appointment for HPV vaccination, and I would encourage my female patients and any female that could watch that podcast to get tested and to get vaccinated, because this saves life. So I think there is no other better encouragement to be tested and to be vaccinated than the fact that this protects, this saves life. This is vaccination against these types of cancers. So I would like to welcome all the patients that would be interested, and I hope they all will be.
I'm sure after hearing today's topic, I think that maybe the key here is, we used to say prevention is better than cure.
Definitely.
And prevention is definitely much better than cure if there's no cure. And thank you very much, Dr. Zofia. This brings our episode to an end today. Thank you very much for listening. Stay tuned for a new episode of Al Majlis podcast very soon. Dr. Zofia,
Thank you very much.
Thank you.
Thank you for having me.